Hello, it's the Fly Foot Doctor, foot and ankle surgeon, practicing in Houston, Texas. Welcome to my YouTube channel. Today we're going to be talking about bunions. You know, how do you make decisions about your bunion surgery? Which one is going to work for you? What are some of the post-op time? What does pain feel like? And all of that stuff. If this is something you're interested in watching, please stay tuned. If you're new to this tribe, welcome. I'm the Fly Foot Doctor, Dr. Shabawali. I practice in Houston, Texas. You can follow me here on any of my other social platforms. It's the Fly Foot Doctor there as well. If you could please share it with your friends and family, I would truly appreciate it. All right, let's get to work. First off, let's talk about what a bunion is. Is it just a bump on the medial side of the toe, or on the inside of the toe, or on the outside, depending on what you refer to it as? And the answer is no. A bunion is just not a bump that's on the outside of the toe or the inside of the toe. It's actually movement of the bone. Now, in the beginning stages, it may just be, you know, growth of that bone. It becomes a little big, so to speak. And so things like just shaving it could kind of help. But with time, it actually is an increase in what we call the intermetatarsal angle, which is the angle between that first bone and that second bone. It starts to increase. And so we're seeing that, you know, the bunion, especially those that are progressive, start a little bit more behind all that you see that's causing pain and discomfort. All right. So that's essentially the nutshell of how a bunion can come about. Typically. Now, of course, there are other things that could cause a bunion, like trauma, you know, some shoes that you wear don't necessarily cause a bunion, but they could worsen or speed up the, you know, the effect of having a bunion, essentially. All right. So that's essentially what happens when you're having a bunion. Another big question that I get asked is, are bunion hereditary? And absolutely. Now, we talked about how the bones are moving. And so in patients that have, you know, some sort of hypermobility, they move a lot, they can touch the back of their back of their shoulders, you know, all the way. And then they have family members that also have bunions. That could also increase the chance that they may have a bunion as well. You know, there are patients that are hypermobile that will have a bunion. Patients that have rheumatoid arthritis that will have a bunion because, you know, that joint is just destroyed and it's moving in whatever way and find a position it's going to rest in. And so to answer the question, yes, bunions are absolutely hereditary. If you are not sure if you're going to develop a bunion, you could check your grandma, check your mom, check your family member, check your dad. You know, I say this often. I have 3 family members who have bunions, and thankfully that gene skipped me. All right, so I know that it runs in my family for sure. All right, hi Dad. So they are hereditary, and if someone in your family has it, you do have a chance that you may have it, but you may just be lucky and not get it as well. Now, another question I get asked all the time is, well, can I stop the progression of a bunion? You know, is this something I can do? And the answer is maybe, okay? And when I say maybe, I'm talking about if you get one of these bunion sleeves, those, I will put the disclaimer, never correct a bunion. They don't reverse it. Once you have a bunion, it doesn't go back straight without surgery, contrary to what everybody tells you or what these people are selling you. However, those bunion splints could potentially slow down the progression of the bunion, meaning it could slow down and reduce the period of time between when you have it or you notice it to when it starts to get worse, okay? So that's when I would use it. You know, if you use it every day, for a year, I think that you absolutely will see that you will not get as worse as you could potentially get if you didn't use it. Personally, I like to use the bunion splints after surgery to maintain my correction and aid in healing in the corrected position. All right, so we get you to, you know, heal in the corrected position, and then we try to maintain it that way. All right, so that's when I use a bunion splint. But as far as reversing it, though, no, those splints don't work, but you could potentially reduce it. Now, by what percentage could you potentially reduce the reduction? I don't know that number, but I think it's worth a try, you know, but just don't go thinking that you're going to go back to having no bump, because honestly it doesn't work for that. Now, what are some of the conservative non-surgical things that you could do if you have a bunion? So I will always recommend you wear wider toed shoes, okay? Make sure that you wear shoes that have the wide toe box that allows room for your bunion to breathe. Let's the bunion breathe, okay? You don't want to keep squishing it because, interestingly enough, we have something here called a bursa. A bursa is a fluid-filled sac that lies between the bone and the skin and acts like a cushion, kind of like a soft pillow, so that you're not just rubbing skin on bones. Now, with chronic inflammation and chronic bumping, that bunion, that bursal sac can actually swell and it makes that bunion look worse. Now imagine it's swollen and you're stuffing that thing in a stiletto, narrow tipped shoe. That's going to hurt significantly. So wearing a wider toe box shoe is essential. If you're going to wear some sneakers, you want it to have some stretch or some give to accommodate your bunion. That is what you need to do. Also, you could wear some of these Bunion silicone sleeves. Those really help as well to cushion that area and help with improvement, okay? So those silicone sleeves, you can wear them with your sneakers. You can wear them with your shoes. They help to, again, act like an extra layer of protection in your shoes to prevent rubbing and discomfort when you're walking around. Orthotics are another option. So orthotics really help as well. They help to realign that joint. They don't help to remove the bunion because honestly, nothing removes that bunion except surgery. But what we're trying to do is to accommodate it and avoid surgery. So that's what we're talking about, the conservative options right now. So a custom orthotic is an insert, not the ones you get over the counter, but an insert that you put in your shoe that can help you realign your foot and sometimes help with the discomfort that you feel on the joint. Now, some people don't care to be conservative. They want to have surgery because either A, they don't like how the bunion looks, they don't like how their foot looks, or B, they actually have significant amount of pain from this bunion, or D, they have pain, they don't like how it looks, and they've actually tried conservative treatment options, but it's proven unsuccessful. And in that case, they want to have surgery. Well, brother, sister, it doesn't matter what your reason is, there is a surgery for everything. You heard? So that being said, I like to break down my surgery or my protocol into 3 options. For mild bunions, for moderate bunions, and for severe bunions. Of course, the technical thing that we do is measure the angles and all of that stuff, touch your foot, move the toe around, and kind of see what kind of give and things like that. All right. In addition to that, I also ask important questions of you, meaning what are your goals? What do you want to achieve? Do you just not want to have pain? Or do you just not want to have that bump anymore? Okay. And then I need to ask you, what is your requirement at home? Do you have a 1-year-old toddler that's running around and you need to chase around? Because you can't be off your foot if you have a newborn baby and your feet is hurting like crazy, right? Do you have a job where you stand all the time? Because then we need to take an appropriate time off from work if you have a severe bunion and we have to do a more involved procedure. So there are questions that we have to talk about and see how we can merge and meet somewhere in the middle where I am able to give you the foot of your dreams and you are able to achieve the results that you want. So that being said, for me personally, I perform, all the bunion procedures. So what I break them down again, mild, moderate, and severe. So for me, I perform the minimally invasive procedure without hardware, the minimally invasive procedure with hardware, and more of the fusion procedures, of course, with hardware. And by fusion is when we fuse 2 bones together so that they don't move and you don't keep having the bunion. Okay, so those are the 3 procedures that we perform here at Bunion Foot and Ankle Center as well. Now, who qualifies or who would I recommend a minimally invasive procedure without hardware? These are for patients who have mild bunions. They just have a bump. They just don't like the bump. They don't have any family history. It's not progressive. That bump has been there the same size for years and years and years. It's not changing. Bump either at the top or on the side. They just don't like it. There, we can perform a minimally invasive procedure. We're able to even do a little bit of a bone cut and even do a little shift, but nothing too extravagant. So again, we use it more for mild bunions. Now, who will we do a minimally invasive procedure with hardware? Patients who have, again, mild to moderate. If I think I need to do more of a shift to give you the desired outcome that you want, then I will give you do a minimally invasive procedure, but I will use hardware to hold the correction in place. Because again, I need to cut some bone and perhaps shift it a little more and give you that nice flat edge that you desire, okay? And when I say minimally invasive, it means I don't have a big scar like you would see with somebody bunions. It's a very small scar. They're hidden. It gives a more aesthetically pleasing result. Now, when would I do a fusion? I typically would do a fusion if you have a severe bunion that is getting worse and worse. It means that it doesn't matter what we do, even if we do the minimally invasive, in 5 to 10 years, this is going to come back. Sometimes even as early as 2 years, this is going to come back. So in that situation, we need to attack the base, okay? The mothership, the background, the foundation of that bunion, and fuse it straight so it doesn't keep moving. So that is what we would have to do. And in that case, again, maybe a patient with rheumatoid arthritis, or a really, if you see those patients who have really bad and severe bunions, those are the ones where we would do a fusion for, and the post-op period is a little longer for those. Now, for my practice, our post-op protocol differs depending on the procedure that's been chosen. So you can be back in your shoes as early as, between 2 to 3 weeks, or it may take sometimes about 6 weeks, depending on the procedure you choose. So the less invasive, so minimally invasive, the less invasive the surgery, the quicker you are to return to activities, the quicker you are to return to work, the quicker you are to go back to your sports and your games and all of that stuff, okay? Now, the more involved it is, the more rest we need, the more time we need off our feet, okay? So this is something that we would discuss when we meet. We take x-rays, we do a physical examination, and see what's going to work best for you. Now, another question I get asked a lot is there pain with bunion surgery? Well, because we're doing minimally invasive, meaning that we're not messing with a lot of the soft tissue, the nerves and things like that, there is less chance of pain. So my patients typically, a day or two, they're feeling better. They don't need to take their medicine. I saw a patient that I did her surgery on Friday today. This is Monday. I'm recording this on a Monday night at like 11:35 p.m. Anyways, she did her surgery on Friday, and she said honestly she just took it maybe Saturday, maybe Sunday, and the day she came, she said I honestly didn't have to take anything. And that's because we did it minimally invasively, so we're not messing with a lot of the tissues that potentially cause pain. The swelling is minimal because more swelling equals more pain, and so all of that makes minimally invasive a little more tolerable than a more invasive procedure like a fusion, where we do have to open it up. We do have to, get the joints cleaned and prepped and things like that. So there's a little bit more pain. There's a little bit more swelling. But again, once managed appropriately, we take good care to make sure that we're not messing with the nerves so that the patient has a pleasant outcome altogether. So we've talked quite a bit about bunions today. We talked about how they form, the conservative treatments, how we would treat it, the different procedures and things like that. If I wanted to talk about bunions, about everything, we'll be here for hours, and then you'd get bored and leave. And I don't want you to do that. I want you to hang around. So I will end this video here. I think I've answered most of the common questions, but if there are other questions that I haven't touched on, or things that you want to know that I didn't discuss, leave it down below. I'd really love to answer it for you. And if this video was really good for you and you learned a lot, would you consider staying and subscribing to us? Also, would you share this video with friends and families, or anyone who you know may have a bunion and will really benefit from it? I would really love to be able to help touch them and just kind of educate them as well. If you want to see me personally, you can book a follow-up appointment. Link will be in the bio down below on our website, or you could give us a call. We could take virtual consultations as well. And again, we're able to do our procedures, our minimally invasive procedures, in the office, so you don't have to go on the general anesthesia, especially if you're scared of going on the general anesthesia, or you just don't want to and you want to be able to be awake, or maybe not even awake. You can fall asleep, but at least be alert, be responsive when we ask questions. We can do that in the office as well. So if you're interested, definitely give us a call, or leave a comment down below, or DM us, or visit the website. All right. I appreciate you. If you want to follow me, The Fly for Doctor, that's my name on all platforms, as well as our practice information is also down in the link below. Thank you so much for sticking with me. Till next time, I'll see you later. Bye.